Hello guys, good evening. Welcome back to our YouTube channel. This is Felix Ruben, one of your very best YouTube presenters. Today we are talking about a common condition and we are not going to give a damn in managing it. Now, this is nose bleeding or rather epistaxis. Nose bleeding can range from a trickle to a strong flow, and these consequences can also range from minor annoyance to a life-threatening hemorrhage. Okay, guys, in the pathophysiology we are going to talk about two types of nose bleeding. We have the anterior type and we have the posterior type. Now in the anterior type, it originates mainly in the deep plexus vessels, that is the anterior septum, what is forming the Kiesel Batch area. Okay, now the Kiesel Batch consists of three main arteries, guys. Don't forget, we have the anterior ethmoidal artery, we have the posterior ethmoidal artery, and then the third one we have splenopalatine ethmoidal artery. Okay, guys, posterior is not very common, but then if you have to get the posterior, you'll also have to handle it the way it comes. Okay, it normally originates from the posterior septum along the underlying vomer bone. Okay, we have what we call the vomer bone, or on the lateral side, it's situated in the inferior or the middle turbinate. Okay, that's what we call the turbine. So it's sometimes in the turbinate. Okay, now most of the times, people who have pre-existing condition or the blood disorders might experience the posterior nose bleeding. Okay, but then these are some of the key evaluation you'll do to someone with such type of presentation. Now, in your evaluation, you'll have to do a very nice history taking. Nice history taking, you'll check on all the particulars of the patient and the way it is coming chronologically up to where you get to find out which type of bleeding is this. Okay, now you will have to talk about the red flags. There are so many red flags. If you get a patient with nose bleeding, these red flags you must evaluate. Okay, if someone has used any anticoagulant like warfarin, aspirin, if there are too much reoccurrences of nose bleeding or bleeding that is of more than even if you apply direct pressure, it's still happening, then that is our red flag. Somebody having hypotension, somebody developing hemorrhagic shock. You see, these are some of the things you really have to check in your evaluation. Okay, now nose bleeding is very serious, and you really have to know a bit of the etiology. Etiology, we look into causes. We have the local causes, or the common causes, and the uncommon causes. Now, the common causes, we have local trauma that could be caused by maybe blowing of the nose or picking. Okay, and then we also have the drying of the mucosal regions. Okay, now most of these causes that are uncommon are like the septal perforation, we have the arteriosclerosis, we have some of these infections that are leading to nose bleeding like rhinitis, we have what we call the Rendu-Osler Weber syndrome. That is a syndrome that is not common, okay, but it takes place. Okay, we have the coagulopathies, we have the foreign bodies, we have the tumors. Those are some of the uncommon causes. But then you can also experience these causes bringing nose bleeding. Okay, now if you get a patient bleeding so much profusely, in the nose at home, then you don't know whether this is anterior or posterior. Okay? Make sure that you're calm. Calm yourself. Once you've calmed yourself, make sure that the patient sits upright and they lean forward. Okay? Once they have been in that position, then you make sure that you personally apply pressure. Pressure you're going to apply just, this is the bridge, the nasal bridge here. This is the bridge. This is the root of the nose. This is the nasal bridge. Now, just below the vama bone, okay, you'll have to apply direct pressure with both hands. Yeah, you just apply pressure. Okay, you'll have to make sure that the reason why you are applying pressure is to make sure that the bleeding does not become too much. And at the same time, you have to make sure that the airway is very, very patent to avoid some of these obstructions that might lead to death so quickly. Okay? Actually, ABC must be considered. Airway, circulation, and breathing must be considered. Okay? And now you will have to ensure that you have a cold towel, or rather what we call the ice, cold ice. You put it on the face. It also minimizes the bleeding. Another thing, you'll have to make sure that pressure is applied there for around 15 minutes. Okay? If the bleeding still persists, then you'll have to seek for medical attention. Okay? And you really have to be so quick in this, because you might lose your patient on some of these conditions. You might anemia, hypotension, shock. You might lose the patient because of that. Now, we have the anterior bleeding. The best management that is normally done here, you apply the maneuver that you apply is actually pressing the nasal allies both up to 15 minutes. By pressing there, you'll be giving direct pressure. If that fails, then you'll have to do what we call the anterior nasal packing, okay, with gauze. Now, if you are evaluating and you want to manage posterior bleeding is you normally do the commercial balloons, and you'll have to insert them in a facility where there are so many equipments and you also follow the instructions of the company that have been given there. Now guys, that is just a very, very simple way of managing nose bleeding even at home, in the hospital.